Hi, my name is Chelsea, and I will be doing a head-to-toe assessment, and I'm with Brenau University's FNP program. This is my patient, so I'm going to introduce myself to her. I come into the room, wash my hands, introduce myself. Hi, my name is Chelsea. I'll be the FNP student that's going to be doing your head-to-toe assessment today.
Okay.
Okay. Do you have any questions?
No.
Okay. What's your reason for coming in today?
Just a physical exam.
Okay. And can you tell me your name and date of birth?
It's Jessica Callahan. It's 7/15/1991.
Okay. Do you know what year it is?
2018.
Do you know who the president is?
Trump.
Okay. So upon this, I can determine that my patient is alert and oriented. When she walked in, we'd also assessed her gait, which was steady and appropriate. Next, I'll be doing just the general assessment and the starting at the head. So for general assessment, she is appropriately dressed for the weather. Her speech is not slurred. Her affect is appropriate. It's not flat. She doesn't appear in any distress. And then starting at the head, we're going to look at the skin. Overall skin is intact. No lesions, blemishes, any like irritation or anything. And then we'll start at the head. So we'll start at the hair. So the hair is dry and thick. It's not breaking off or anything. And we'll assess the scalp. So we'll palpate just for any lumps or unevenness for a normal cephalic scalp. Okay, sorry, I messed up your hair. Okay, then we're going to look at the eyes next. Okay, so for the eyes, I'm going to ask you to take off your glasses for me. Okay, sorry, I lost my light. Okay, so first thing, we're going to check your pupillary response. Sorry, this light may be a little bright. Okay, checking at both sides. Making sure they constrict equally on both sides. Okay, then we're going to test your visual gaze in all 6 areas. So just follow the end of this light right here, the tip. More. And done. And now we're going to just test accommodation. So you're going to follow this into your nose and then back out. Okay, so eyes accommodate. We're also assessing the sclera, which is white. A little bit of redness, but no edema or anything like that. Conjunctiva is pink, no redness there. Okay, next is the nose. Okay, so the nose, we're going to be assessing the nares for patency on both sides. Blow out for me. Blow out for me. Okay, so we have patency both sides. We're going to just check in the septum. I'm going to peek with my light.
I have a cold.
You have a cold? Okay, we'll look. Brain type of drainage. Light. No nasal drainage. No redness. Anything of that. Okay, next we'll check the mouth. I'm going to get you to open up and say "ah" for me.
Ah.
That's how we're going to assess the gag reflexes because I do not have a tongue depressor on me. And then stick out your tongue. Okay, lift up your tongue for me. We're checking for any type of masses, checking teeth, making sure there's no erosion, decay, no broken teeth, checking the oral mucosa, make sure it's pink and moist. Then next we're going to move to the ears. So for the ears, we're just making sure that they are, sorry, get along here, making sure that they're symmetric on both sides. We're going to palpate the orca all the way around. Checking for any lumps, any type of lesions or anything. Then we're going to inspect the inner ear. Just checking in the inner ear for any type of redness. And then we're looking at the tympanic membrane on both sides, making sure it's pearly gray. No redness, swelling, or bulging. Any pain?
No.
Okay. Also looking for drainage, any type of wax or anything like that. Let's see. Then next we're going to go to the throat. Okay. So the throat, we're going to be inspecting the trachea, making sure it's not deviated on any side and it's midline. Also going to be palpating the thyroid. Then we're going to be checking your lymph nodes. No pain or tenderness?
No.
Okay. Okay, then we're also going to test your strength. Okay. So I'm going to get you to turn against my hand. Okay. Good. Other side. Good. I'm also going to test your strength in your shoulders. I'll place my hands on your shoulders and you push up for me. Okay. That. Let's see. We're going to also test your arm strength. So you're going to hold up, push up on my hands, push down, pull in, pull out. Okay. And while we're at it, we'll also test your facial nerves. Okay. I'm going to get you to smile for me. Okay, frown. Open your eyes really wide. Close your eyes really tight. Okay, good. And we're also going to test the touch, like on your face. Let's see. We'll use, oops. I don't know what this is, but they're just going to tell me which side you feel it on.
Right. Top left. Top right. Chin.
Okay, good. So those are intact. Next, we're going to be inspecting her posterior side. You just want to turn a little bit for me. Okay. Just going to take normal breaths in and out for me. Okay, so we're just checking for the AP diameter, making sure she doesn't have any flail chest, anything like that when she's breathing. Okay, we're not going to check out her clothes, but we'd be inspecting on a normal exam for any color, rashes, bruises, anything of that nature, moles, anything abnormal that we would inspect. Then next, while we're back here, we can palpate the spine for the vertebral column. Okay. And then we're also going to palpate the kidneys. And then while I'm back here, I'm also going to listen to her lung sounds. Okay. So to tell you when, just take a deep breath in and out.
Okay.
In. Out. In. Okay. So lung sound resident. There's no any type of crackles or wheezing or any abnormal audible sounds. So now we're going to get you turned back around. We'll listen to the front. Okay, so the front we'll be inspecting along with the neck and the heart and everything. We'll check the carotid. So we'll go ahead and do that. We'll just turn, just make sure we don't have any jugular vein distension. It's not present. Turn that way for me. Not present. And then we're going to check the carotid one at a time. Okay. Okay. Then also we'd be inspecting the chest, make sure there's no like petechiae, any type of rashes or anything there that could be present. And then we'll start at the neck, listen to the carotids to make sure there's no bruise or thurls. Be listening with the bell. Okay, so I'm going to put this on you. You're going to take a deep breath in and hold. Okay. And same thing on this side. Okay, good. Okay. Next, we're going to be listening to your lungs and your heart. And we'll kind of do it simultaneously. Okay. So the first two, you can just take deep breaths in and out, and then you can breathe normally. Okay. Okay, breathe normally. Okay. And then while you're sitting up, we're also going to feel for any type of pulsations at the lower aorta, just to make sure nothing's wrong there. Any pain?
No.
Okay. That's it for sitting up. Next, we're going to lay down. Okay, now that the patient's lying flat, we'll continue the next part of the assessment. Step on this side of you. Okay, so the next part of the assessment, just like we were doing when you're sitting up, we're just going to assess pulsations of the aorta again. Okay? Just going to feel no pain there?
No.
Okay. We could also, while she's in this position, assess the JVP. I do not have a ruler, but basically you're going to be measuring from the jugular to the top of the chest. And you're wanting to make sure it's within 3 to 5 centimeters. And then next, we'll be listening to the chest again. We'll just be listening to it on her left lateral side, just so we can get the most accurate sounds. And we'll get you to turn on your side for me. We'll also be listening to all 5 places with the bell and the diaphragm. Okay. We'll go back to the bell. Okay, you lay back on your back. Doing on the left side, we're assessing for any type of murmurs or extra heart sounds. Okay, next I'll let you put your hands at your side. We're going to go to your stomach area. Okay, so first we're going to inspect. Obviously, we would lift up the shirt or the gown. Okay, so we're just inspecting, like everywhere else, for color, any color, any types of bruises, rashes, lesions, anything like that. Okay, so nothing appears present. Does have a tattoo on the side. Okay, so next we're just going to listen. We'll listen to the aorta, where you pulsated earlier, as well as your vowel sounds. Okay. When was your last bowel movement?
A few days ago.
Next, we're going to palpate, okay, for any types of masses, any like ascites or fluid movement, anything like that. Okay, so we'll do like a light palpation and then we'll do a deeper palpation. Okay. Just tell me if there's any pain, any tenderness. No. Okay, we'll do a little deeper. With pain. Okay. We'll also be checking, see if we can feel any liver enlargement. We'll take a deep breath in. Okay. Deep breath out. Also be checking for the spleen. Any type of enlargement there. Take a deep breath in. And then out. Okay. We're also going to percuss, basically just see if there's any different noises that could be happening. Up here. Okay. So that's it for the abdomen. Then we'll move down. For the inguinal area, we'll be checking pulses, also checking lymph node enlargement, anything there. Okay. I'll also be checking, palpating the hips, making sure they are symmetric on both sides. Okay. Let's see. And then also, before we get down any further, we're going to test like your arm strength and equilibrium. I'll let you hold that up. I'm going to count, okay? Basically what you're going to do, I'm going to count to 10. You're going to try to keep your arm up at that level, okay? Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, you can lower that arm. Lift up this arm. Okay, same thing. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, you can lower that. We're just checking to make sure there's no drift in the arm movement. We'll also be checking your arms. We're looking for color, any type of lesions, scars, checking the temperature, checking the radial and ulnar pulses. Then we'll move down and check capillary refill. Also assess for any type of clubbing in the nail beds. You got your nails done, so it's a little more difficult. And now we'll continue to the legs, the lower extremities. So we'll be checking for color, temperature, just like above any lesions, scars, anything like that. So we'll move down the leg. We'll also check for any type of edema present. We'll check for any pitting edema. No swelling. We'll move down to the feet. Okay, so we'll check the feet. We're going to be looking for any type of ulcers, any dryness, ingrown toenails, anything of that nature that could interfere with walking or stability. Also, you're going to be checking the pulses down here bilaterally. Okay, and we're also going to test your strength on the lower extremities like we did on the upper extremities. So in the lower extremities, we'll do the same thing, but we're only going to count to 5. Okay, so you're going to lift that leg up in the air. 1, 2, 3, 4, 5. Okay, turn that back down. Lift this leg in the air. 1, 2, 3, 4, 5. You lower that one back down. Okay, and we're also going to be checking the strength in your feet. You lift, push up on me, push down. Okay, good job. That's good. And then one more thing, squeeze my fingers. Squeeze tight. Okay, good. Okay, so that's it for laying down, so we'll assist you back to standing. Okay, so now that my patient's standing, we're going to be checking some other things like the spine and her gait and everything. So for the spine, I'm going to get you to turn that way for me. Okay, you're going to bend over at the waist. Okay, we're going to be checking vertebral column for any type of scoliosis. And then we'll also be checking the front side, checking the shoulders, make sure they're equal on that side. Okay, and you can bend back up for me. And then while you're up, and we'll get you to turn, keep your hips straight though. We're there, just like that. And turn this way, and then bend back just a little bit for me, just like that. Okay, you can turn back towards me, just assessing the range of motion of the spine. While you're up, I'm going to get you to stand up against this wall. We're going to assess your gait, but while you're standing up, we'll read the Snellen chart just to see from far away the acuity. Okay. So we're about 6 feet away right now. So if you can read the smallest line for me.
DEFPOTEC.
Okay. So you read with the acuity of 20 of 20. That's good. So basically what everybody else can see at 20 feet, you were able to see at 20 feet. Okay. So now that you're standing here, I'm going to get you to walk a few different ways. First, just walk normally for me. You can just stop right here. Okay, so we're just assessing gait. There you go. No waddling or anything like that. Next, you're going to walk on your heels to the wall. Okay, good job. And then next, you're going to walk on your tiptoes back here. Okay, and now we're also going to test a little bit of equilibrium. You're going to walk with heel to toe with your eyes closed. And I'll tell you when to stop so you don't hit the wall. Keep going. Okay, you can stop. Yeah, you can stay up straight. Okay, you can turn back around. Okay, now you're going to hold your arms out for me. You're going to close your eyes. Okay, that was just testing the Romberg test just for her equilibrium. And then while she's standing, we can also assess for any type of vein distension or anything down in her lower extremities, which none appear to be present. And then after that, we're done with the full head to toe. So if there's any questions you have for me.
Am I normal?
Yes, you're normal.
That's all.
Okay. Well, it was nice to meet you.
Yes, me too.
And I will see you back in 6 months.
Oh, okay.
Okay.
I don't know if my insurance will pay for that, but okay.